Good afternoon, and welcome to another edition of Facebook Live from Chisholm, and Kilpatrick. My name is Christian McTarnigan, and today I'm joined with Elise Gillespie and Jenna Zelmer, and we are all attorneys here at CCK. Today, we're going to talk about foot conditions. So let's start at the basic level. Elise, do you want to talk about some common foot conditions that veterans might get from their times in service?
Sure. There is really a wide array of different foot conditions that you can get. Some really common examples are pes planus, also known as flat feet, plantar fasciitis, which involves your heel. You could actually have loss of use, or also even just arthritis.
Jenna, do you want to just in a very 10,000 foot way explain what loss of use is? It might be pretty self-explanatory, but loss of use does get just a little bit more complicated in VA world, as some things do.
Yeah, so there are actually two different kinds. You can actually have lost your foot anatomically. For example, if you were involved in an IED explosion or something like that and you had to have your foot amputated, you can actually have lost your foot and you can get a certain amount of money for that. It's obviously service connected if it happened in combat. But the other way, which is a little bit more nuanced, and I think a lot of times VA has trouble rating and kind of figuring this out, and veterans obviously are also very confused about it, is loss of use, which means that even though you didn't actually have your foot amputated, it's the equivalent of having your foot amputated and having the same amount of function as you would if you had a prosthetic. And so if your foot is basically useless, if you need assistive devices, and it would be essentially the same amount of use if you had a fake foot, then you can have a certain amount of money from VA, assuming VA makes that finding for you and determines that it's related to service. So there's a lot of kind of hoops that you have to jump through before you get to that stage, but it is possible to get loss of use.
Yeah, you might just assume that it's for completely losing your foot, which of course it is, but there's also another way under VA law to have sort of like an equivalency to losing your foot. So we just wanted to note that.
Yeah, I think it's important. That's something that, it's really helpful if you reach out to your VSO or if you have a private attorney, you can kind of talk about the issues that you're facing with your foot, and they can kind of give you some advice on whether or not it's feasible to get a rating based on loss of use.
So those are a few sort of common foot disabilities, foot disorders, foot conditions, but we're sort of jumping the gun a little bit here because before you sort of get into the world of VA law, VA compensation, VA disability, you need to be service connected for those disabilities. So Jenna, do you want to sort of maybe talk about the first couple of steps of service connection?
Yeah, so we actually have a whole Facebook Live that kind of goes into more depth on the elements of service connection. But just as a refresher,
we're going to be brief here.
Yeah, as a refresher, before you can get compensation from VA, you have to prove that your disability is related to service. And so you generally have to have a disability, a current disability, whether or not that's a diagnosed disability or a broader definition of what a disability is still kind of up in the air, and there's some arguments that you can make about that. I think
like symptoms,
exactly,
right?
Symptoms that result in functional impairment. We would argue that that's enough, even if you go to a doctor and say that the doctor doesn't find an actual diagnosis. The second step is that you have to have an in-service event or injury, and so, like I mentioned, an IED blast is an example of that. But you can also just have something minor if you are in service and you go to the doctor and you complain of foot pain. That's enough to demonstrate that something happened to you in service. There's a wide array of that. So even if you don't have treatment notes for that, if you have lay statements that kind of demonstrate that something happened to you in service, that's enough. And then the third element is a nexus between that event in service and your current disability. And so I think that kind of gets into what we're going to talk about in a second, which is VA exams. But that's kind of the broad view of how you can first get the first element of service connection before you get into the ratings.
And it can be something, just before we move to our first question, it can be something serious, but it also can be something like there's a lot of PT that happens, obviously, when you're in the service. So overuse, running, if you have sort of a foot problem that begins in service, that's the type of thing. It doesn't always have to be, some sort of explosion or something like that. It can be something that just leads to foot pain and then a later disability.
Yeah. Lexa has a question.
So we have a question from Lexa. We're going to jump right into it. Does loss of use count such as balance or instability issues? If so, what kind of medical documentation would be needed to back that up? So I think the question is, can balance or instability be considered loss of use, and what's sort of the best maybe medical evidence to use to help get a rating for that? What do you guys think?
I'm not sure that instability would be quite enough to qualify
But
for loss of use. Maybe balance.
Sure.
I think
Maybe they were like sort of the same thing, like being not stable while walking.
there's some language in, I don't know if it's the regulation or if it's case law interpreting the regulation, but there is something that says if you have things that affect like your propulsion balance, and propulsion, like your ability to balance on your foot and then like go forward, it's possible that might, those are kind of examples of something that would tend to demonstrate towards loss of use. But I think, like you said, it's a little bit, instability is a little bit on the cusp. And I think it just kind of depends on the specific facts of your case.
Yeah. And
loss
I think
of use is a pretty high bar.
Yeah.
And that would, you pointed this out earlier, Jenna, the equally well served by prosthetic device. So that's going to have to be, a really severe disability. Although very minor disabilities can be service connected, when you're starting to get into loss of use, you're really talking about very severe disabilities. And then in terms of medical evidence, medical evidence can be helpful if you have a doctor that's willing to write a statement that talks about how your foot disability affects your ability to walk and, things like that, or a lay statement even. Those are potentially types of evidence in cases like that we might be able to use.
And even if it's not high enough to, warrant loss of use, it still is something that could be rated, even if it's not quite that loss of use. Loss of use is actually rated at a 100%, so it might be just lower than a 100% rating.
But still, could get a
pretty high rating, yes.
So, the foot is a pretty complicated part of our bodies. There's a lot of joints. There's a lot of muscles in there.
A lot of bones.
Yeah, and there's a lot of different foot disabilities you can have. So before we move into we get into the C&P examinations, VA examinations, is it possible, just before we get into the specifics of it, to get rated for more than one foot disability?
Yes. So we might actually be talking about this later when we get into ratings, but
Stay tuned for the more complicated answer to this question.
The way that VA rates foot disabilities, there are 8 specific diagnostic codes, and we'll maybe talk about this a little bit later in terms of like what a diagnostic code is and how do you get an increased rating, but there are 8 specific codes that VA categorizes foot disabilities under, and then there's a catch-all 9th code. And so it's possible that if you have multiple foot diagnoses that fall under those different codes, you could get separate ratings, or if you have one diagnosis that falls under a code and you have one that doesn't fall under a code, it could possibly get one listed specific code and one of the catch-all codes. And so, I think we've touched on separate ratings in a lot of other Facebook Lives. If you have different symptoms, you can get separate ratings. I think with feet, it's hard because the foot you think of as like one big thing that like everything is just going to affect your ability to walk, but there are actually, Elise mentioned earlier, there's flat feet, but then plantar fasciitis focuses a little bit more on the heel, and so you can get different ratings based on what part of the foot. Maybe it's the toe versus the heel, things like that.
Or bunion, something like that.
Yep. But a lot of it causes pain, and that's sort of where it gets a little tricky. We'll get into that more later. So let's assume that a veteran is... I guess maybe we don't have to assume this, but let's talk about C&P examinations. Both maybe, Jenna, do you want to maybe talk about for purposes of service connection, and Elise, you maybe want to talk about for purposes of ratings?
Sure. So I mentioned that service connection, the third element of that is a nexus between your current disability and your in-service symptoms. And so most of the time that element of service connection requires medical evidence. And so VA is more often than not going to order a VA examination as long as there's some suggestion that your current disability is related to service. We have a Facebook Live about VA exams, and so they go through kind of when VA's duty to get an exam is triggered, but it's a pretty low threshold.
Not everyone has to get an exam.
Exactly.
But if there's that small indication that it's related to service, you should get one.
And so, if you have a diagnosis or a disability and then you have evidence of an in-service condition and there's some suggestion that those two are related, the VA is usually going to order you to go to an examination. You should always go to your exam.
Absolutely.
And, a VA examiner in that situation is going to be focusing mostly on your current symptoms and what happened to you in service. And they're going to issue an opinion based on whether they believe in their medical expertise, whether or not the two are related. And so if they issue a favorable decision or a favorable opinion, VA will hopefully grant you service connection.
They should.
If they issue you an unfavorable opinion, that's not necessarily the end of the world. You can always rebut that opinion. You should always ask for a copy of the exam. VA does have to give you a copy if you ask for it, but they're not going to give you a copy if you don't ask for it. They don't have any duty to kind of provide that for you without a request. And so, if it's a negative exam, you can always go to a private physician. You can get your treating doctor if you're currently getting treatment outside of VA, and then kind of try to rebut that. But like I said, we have a whole Facebook Live that goes really deep into VA examinations and what kind of is most helpful for veterans. Sure. But just from a broad strokes point of view, that's kind of what in an initial service connection threshold, that's what the examiner is going to focus on versus...
Yeah, so once you actually are service connected, or maybe even in the same exam, what they're first going to do is they're going to look at what type of foot condition you actually have, and that's going to tailor the rest of the exam. Any VA examination is really set up like forms that are already written. It's not things that your doctor's just writing out. It's really check boxes that they're checking.
There are some narratives.
There are some narratives, but to be honest with you, there's some narratives, but they tend not to be too descriptive in them. So just keep that in mind.
Yep.
So what they're going to be looking at, just for example, if they find that you have flat feet, they'll be looking at your pronation, which is basically how you walk. They'll be looking at whether your foot is tender at the touch. They might look at if it's swelling, how it looks physically, if there's calluses. All of those things are going to go into, check marks, and they're going to look at what the severity is there. At that point, a board would look at that and determine what rating you're warranted based on what the examiner says. A couple of things to keep in mind with an examiner is you almost never will have met that examiner before. It's not your own examiner. So it is, like Jenna said, it is very important to get those exams to make sure that they are an accurate representation of what actually happened in the exam, and a full representation so that everything that you've said is actually there. If they're not, then I would encourage you to write to the VA and with specific points that you have.
So we've been talking about a lot of medical evidence, and I think this segues nicely into what other types of evidence can you use to support your service connection claim, or you already talked a little bit about maybe your treating physician or something like that. So what about in terms of a rating?
I mean, lay evidence is always good. So lay evidence means both statements by yourself and also statements by people who have actually physically observed pain that you might be in. Maybe somebody that you live with or somebody that you work with, they can see that you're limping or that you're wincing in pain, anything like that. How long that you can stand for certain amounts of time. Those things. It doesn't have to necessarily be something that's strictly in the rating criteria. Jenna's going to touch on this later when we talk about the ratings, but anything that you can put forward to show your functional loss is helpful evidence. So maybe you can only stand for 5 minutes before the pain basically is too much and you need to sit down, or maybe you can only walk to the other side of the room and then you have to kind of take a break, or even if it's not that severe, that type of evidence is helpful.
Yeah, I think one point that I see sometimes when looking at veterans' files is that they look at the rating criteria and try to tailor their statements around the rating criteria. For example, if the rating for a specific, if the criteria for a specific rating requires extreme tenderness of the plantar surfaces of the foot, which is the bottom of your foot, if it's extremely tender, painful, they'll just write in their statement, I have extreme tenderness.
Yeah. And that might be true.
That might be true, but it's so much more helpful, I think, for both VA and for us who are appealing these decisions, questions to have you speak in your own words and
absolutely.
kind of talk about it from a more practical standpoint rather than trying to use VA's descriptions of certain disabilities, because a lot of times if you're going to use that, then VA is going to look at the VA exams that also use that language and afford the exam more value because that person is a doctor. So like Elise said, just really talk about your own experience in your own words, and have anybody who you're around who's witnessed it support that statement.
I think that's a really good point. And it really does go to two different aspects of it. When you're speaking in your own words, you're going to sound more credible than when it looks like you're just trying to tailor in to get a higher rating. Even if it's true, it's just the way that it is. You need to make sure that you're looking more credible. But the other aspect of it, and Jenna was touching on this, is that you might not be competent to actually be saying that your condition is matches these specific ratings, because that's not really a veteran's job to do. A veteran's just supposed to say in their own, that's why it's called a lay statement, what their experience is. You might not be able to say exactly how your foot, the pronation of your foot, because you're not a doctor. And that is why we get the medical exam.
Or the degree of pronation.
If you try and tailor your language too much into those rating criteria, they might find you either not competent or not credible. So
yeah, that's a good point. One thing we forgot to mention, so before we move on, is don't forget to note your any assistive devices you might use for your foot condition. Right, you might not think that wearing, I don't know, Dr. Scholl's or some sort of prescribed orthotic might be important, but it can be. And although you might be getting them from VA, it never hurts to remind the examiner and VA when they're rating, because the Health Administration and the Benefits Administration, although all under the umbrella of VA, are two different parts of the system that don't always talk to each other as well as they might be able to. So don't forget to mention that. And one thing I wanted to note is we talk about functional loss, and we know what that is. We've all had hundreds of cases on it. Does one of you, or maybe both of you, want to just describe exactly what we mean when we're saying functional loss?
Yeah, so I kind of think of it as trying not to do a circular definition. I think of it as like the result from your symptoms. So your foot, a symptom of your foot is that it hurts, but the result of that, the functional loss of that, is that you can only stand for 5 minutes.
I think that's a great way to describe it.
So it's a result of what your actual symptoms are. Maybe you have calluses all over your feet, but that makes it so that you can't quite walk properly. The functional loss is the result.
That's perfect. Yeah,
that's great.
And I think it's important to remember that all VA ratings are based on your impairment and earning capacity. And so in addition to kind of explaining what that functional loss is, it's super helpful if you can relate that to how it affects your ability to work. And so, as Lee said, if you can't walk for more than 5 minutes or stand for more than 5 minutes and you have a job that requires that, you want to definitely make that known in your statements, and note, if you have any accommodations from your employer because of that disability, things like that.
All right, so we've sort of been going all over the place a little bit, but where we started was having a foot condition in service, having a current foot disability or diagnosis, and then having some evidence to show that what happened to you in service is related to that current foot disability. But there's an entirely different way, that's called direct service connection, but there's an entirely different way that veterans can be given compensation or service connection for that, for a foot disability, and that's secondary service connection. So let's just start with what that is.
Yeah. So basically, secondary service connection, it's like Christian said, it's another avenue at service connection. It's when you have an already service-connected condition that's either aggravating or causing your non-service connected condition. So
let's just assume it's your foot condition.
Right.
Yeah.
So an example of that would be if you have maybe if you have some type of knee condition that's causing you to have a strange limp, and then or a strange gait, and then it results in a foot condition.
Because you're putting pressure on your foot in like an unnatural way.
Or maybe it doesn't even cause it, but it just aggravates your foot condition makes it worse, makes it more painful, then so long as that knee condition is already service connected, you can actually get service connected for your foot condition. Again, you need to show the nexus, you need to get medical evidence to do that, but it's an alternative way. Even though it's not connected to your service, it's connected to something that is connected to service.
Yep. And then what about the other way around, Jenna? And I know we don't want to go too far out of the scope of this presentation, but like, if you have a foot disability, can that maybe cause another disability that you could get service connection for?
So you'd need to get a medical opinion. I'm not a doctor, but
fair enough.
We have had cases where we have had cases where like we said, if you have a foot disability, it's probably going to affect the way you can walk. And so if you are limping or can't put your weight on one of your feet, that could cause some sort of internal issue in kind of the way that your spine is aligned. And so we've had veterans who have back disabilities due to their foot condition, knee disabilities. I think you mentioned that before. Anything that kind of goes up from there. I think there is some medical controversy or dispute. I'm not really sure how well accepted it is in the medical community. Some doctors say it can only go down versus up, or up versus down. And so it's always important to get a medical opinion about that. But it is possible to have a service-connected foot disability and then have something secondary to that service-connected foot disability.
Another one we see it really with anything with pain is a psychiatric condition that would be secondary. So if you're in constant pain and you already had depression, or it causes depression, that's something that we do see quite often with really any condition that's causing
So it doesn't really need to be an orthopedic condition, or it doesn't need to be foot, knee, hip. It can be something entirely
Or if you're on some type of pain medication for your foot condition, and that pain medication causes a secondary disability, maybe an issue with a GI issue or an issue with your liver, something really like that.
A lot of
there's no ends to secondary service connection.
There's not.
If there's a link, between the medical, most likely, sometimes between the service connected disability and the non-service connected disability. So we're going to take a pause here to answer a question from Sherwin. Thank you very much for the question. If you indicated an ankle sprain on your exit examination, but it was never treated, is that valid evidence to start a claim for a foot or an ankle condition? So, and it got worse over time.
So I have a question about whether or not the never got it treated. So there's a couple ways to interpret that. Did you never get it treated in service and then you just indicated it on the exit exam, or did you never get it treated after service but you still want to get it now? And the answer to either of those options is yes. It just depends on kind of
the strength.
Exactly. So if you on your exit exam reported that you had ankle strains in service, but you never went to a service doctor, that's fine. I mean, that happens a lot. A lot of veterans don't get treatment for things that they experience in service. It's actually really good that you at least checked marked it on the exit exam. A lot of times we don't even have that. And so if that's the case, that should be enough to meet the first element that it happened in service. For the second element, whatever, I think I put them out of order, but one of those three elements. And if it's the opposite, if you have it on your in-service treatment exit exam, but then you never got treatment after service, but it continued to worsen, and then finally maybe 30 years later you finally decided that it was enough. It had gotten to the point where you needed treatment. That's still okay. I think a lot of times VA relies on that lack of treatment, that 30 years or whatever it is, to say, oh, well, you clearly just didn't have anything and now you're trying to claim something that just started. But you can, we talked about lay statements. You can, if you self-treated, if there was a reason why you never sought treatment, you can explain all of that. You really want to tell your story. And so that's definitely, if you have a current ankle issue and you had an ankle exam on exit exam, you marked it, and that definitely should be enough to at least start the claim. And then VA has to develop the evidence. You can develop the evidence. You can submit additional statements to support it. But if you have a disability and you think it's related to service, you should file a claim. I think is the takeaway from that.
Absolutely. And it's certainly not legally precluded. It might be difficult, but under the law, that should be a valid.
And sometimes VA examiners rely on that, and they're not supposed to do that.
That's true.
That's Buchanan and Dalton. There's all sorts of case law.
We always have case law names running around in our heads.
Yeah.
All right. So that's when. So that example is when something's noted in service, like in the exit examination. So what if you're a veteran that had a foot condition prior to entry, and then service made it worse? Are you out of luck, or is there something that you can do in terms of trying to get service connection?
You can still get service connection. It is a higher bar. You actually have to show that your condition, instead of just being aggravated, was permanently, basically worsened by your service. So it's a higher bar, but it is allowed. It's under Section 1153. It's another avenue at service connected. But you do have to focus on developing evidence that shows that the condition was not as bad before service as it is after service. I
had a case where the veteran had plantar fasciitis that was diagnosed on his entrance exam, and it was specifically noted as asymptomatic, which means it didn't have any symptoms, but they noted that he had it. And then when he was in service, he started to seek treatment for it, and so it went from asymptomatic to symptomatic. And VA gets this wrong a lot. They say, "Oh, well, there's no evidence that it worsened," and things like that, but that was enough in that situation to at least say, it looks like it permanently worsened. So it all depends on the facts.
Yeah, absolutely. So we've been talking a lot about service connection. We've been sort of alluding to ratings. Why don't we just jump right into ratings? Jenna, do you want to talk a little bit about how VA rates foot disabilities?
Sure. So I mentioned before there are 8 diagnostic codes. They are, if anybody is really interested in
Jenna knows this really well because she had a case on.
So the regulation, all the VA orthopedic regulations are 4.71A, and then they're all separated out by part of the body. So there's a part of the spine, there's foot, there's leg, there's knee, etc. So the foot diagnostic codes are 5276 through 5284, and so 5276 through 5283 are the 8 specific ones. And so if you have a diagnosis that is labeled in those 8 codes, you have to be rated under that code. And so VA will look at your diagnosis, they will compare your symptoms to that code and assign you a rating based on
Pes planus is an example of that.
Pes planus is the most common, I think. Yeah. But there are a few other ones in there. There's hammer toes and I can't even remember now, but claw foot,
Pes clavis.
Pes clavis, lots of weird ones. But Pes planus is definitely the biggest one. And then 5284 is this weird catch-all diagnostic code for other foot injuries. And if you have a foot condition that is not listed in those 8 codes, you can ask for a rating under 5284. Even if it's not technically an injury that you incurred in service, if it's just, a foot pain or something like that. Injury, it kind of implies that you had to have specifically hurt your foot in service. But if you have just treatment records that talk about foot pain without evidence of an injury, that's enough to at least get a rating by analogy under 5284. Do we have a Facebook Live about ratings by analogy? That's a whole thing that we're not going to get into. That just means that you can get a rating even though you don't specifically meet that specific criteria.
It might be hardest in the context of feet, but that's a talk for another day.
But so essentially the problem that happens a lot is that veterans have multiple diagnoses. So you can have pes planus with plantar fasciitis.
Absolutely.
And so it really kind of depends on how bad that is. So sometimes if you have pes planus with plantar fasciitis, you might just get one rating under 5276, which is the rating for pes planus, because some of the symptoms of plantar fasciitis overlap with the symptoms of pes planus. And so if they overlap, you can't get separate ratings because that's what VA calls pyramiding. You'd basically be compensated for the same symptom twice. But if you have a specific rating for pes planus that's pretty low, maybe it's only 10%, and you also have plantar fasciitis, you can at least make the argument that you can get a separate rating under 5284 for the symptoms of your plantar fasciitis, because that low rating under pes planus isn't going to encompass the symptoms of your plantar fasciitis. And so it really depends on what your rating is for the listed diagnostic code, and I'm just using pes planus and plantar fasciitis because those are the most common ones, and they're the easiest to kind of wrap your head around. But and that's probably the one that I think most of the other foot diagnostic codes are only like 10%.
Sure, they're pretty low.
So plantar fasciitis can go up to 50%. So it depends on how bad sorry, did I say plantar fasciitis can go up to 50%? Pes planus can go up to 50%.
5276.
50, yeah. Plantar fasciitis, I think the 5284 goes up to like 30, maybe 50. I can't remember exactly.
But then you can get.
So
suffice it to say, there's lots of people that are out there to be able to help you with these sort of things. Foot disabilities are hard.
Talk to your
trying to do our
service
best.
rep. Talk to your attorney. There's a lot of case law on this because it was kind of unclear for a long time whether or not you really had to have. Like you had to have, if you were rated under 5276 for pes planus, did you have to really get that rating, or maybe you could use this 5284 code because it's broader. The court has really made it clear that if you have a specific listed diagnosis, you have to get that diagnostic code. And then it's the unlisted stuff that kind of gives you a little bit of wiggle room. And so it's super important also, I think the biggest takeaway from this is when you get your exam or you get, a private physician that diagnoses you with a bunch of different foot disabilities, you want to make sure that VA is adjudicating all of those. And
not just lumping them all into one.
And making sure that they are agreeing that they're all related to service. And that they're looking at each one of those diagnoses and making sure that they're compensated. You don't want like a hyphenated diagnostic code in a foot case if you really have multiple diagnoses. And if you do have a hyphenated diagnostic code, you can file a notice of disagreement. You can kind of ask for clarification on why they did that and submit additional evidence about kind of parsing out the symptoms and how they work. But that is rating foot conditions.
So you mentioned a notice of disagreement, and I just want to touch on one point. Notice of disagreement, we're talking about the legacy system there, right? Where it's the claim, the rating decision, the notice of disagreement, SOC VA9 board, right? So is there anything different that you would have to do with an appeal under the Appeals Modernization Act, the AMA, as opposed to the legacy system? Maybe we should just touch on that briefly for our viewers and listeners.
So just really generally.
And we have a lot of information about the AMA on our website.
There's several different lanes that you can choose when you're in the AMA system, but the supplemental claim lane and the board lane are going to be the only two that you're going to actually be able to submit new evidence into. So just keep that in mind.
Perfect. Very succinct. I like it. All right. So let's say you have plantar fasciitis, or I'm going to use pes planus in your left foot, Elise, and pes planus in your right foot. Does anything change about the potential rating you can get in that situation?
Well, if you have, yes.
Good answer.
First of all, the first thing that comes to mind is that the actual diagnostic code, you get a higher rating if you have bilateral pes planus. Just keep that in mind. But
50 as opposed to a 30?
Something like that,
It depends. Sure. It could be it's a 20 versus a 10 or a 50 versus a 30. So keep that in mind. But the other thing is there's something that we call the bilateral factor. So VA math, as it is very confusing and complex. I'm sure we have a lot of resources on our website that explain that. But what the bilateral factor is it essentially, because you have two conditions that are compensable in both your lower extremities, or it could have been both of your upper extremities, you can get actually what's an extra 10% onto your rating. But what that means is it's an extra 10% that gets added into the equation of the VA math. So it doesn't mean that if you have a 50% combined, you're going to go to a 60%. It says if you have a separate condition that's rated at 10%. So it may or may not actually bring your combined rating up. But what that is, that's called the bilateral factor. That's the VA recognizing that when you have a condition affecting both sides, they're giving you a little bit of a bump for that.
Because you can't compensate really with the non-service connected condition, side. I think that makes sense.
So we talked about foot, does it have to be foot, Jenna, or can it be like a knee foot?
No, it can be a knee foot as long as it's separate sides. So the key, like Elise said, is that it has to affect both your right and your left side, and then it also has to be the same half of your body. And so you can't have like a right arm and a left leg. You wouldn't get the bilateral factor for that. But if you have a right arm and a left arm,
you mean like half, like upper torso,
exactly,
lower legs, not like straight down the middle.
Right.
Okay, got it.
But if you have a left foot and a right knee, that would factor it. If you have a right wrist and a left shoulder, that would work. Anything, you're kind of.
But it can't be a left hand and a right foot.
No, exactly. Yeah, so you're literally thinking about cutting the body into like fourths, like at the waist and then straight down the middle, and like it has to be like that. If that makes sense.
Should draw a picture.
Yeah.
All right. So we've talked a little bit about ratings. So there's this whole other area of VA law and compensation that you can sort of get into. We talked about this a little bit at the beginning. If you have loss of use. So we talked about loss of use as being either the anatomical loss, like you don't have a foot anymore, unfortunately, or the severity equivalent thereof. You have trouble with walking, propulsion. It could, it's just as if you had a prosthetic foot. So that's called special monthly compensation. But let's get into just a little bit more of the specifics. So what rates, because SMC is sort of done by different rates, which is different money per month. So what rates of SMC can you get for loss of use? What are they, and how can our veterans sort of try to get those ratings?
Sure. So it's going to depend on what you have the loss of use, or how many basically extremities you have the loss of use in. Because we're talking about fee, we'll just keep the example to that. If you have loss of use in one foot, you have what's called SMCK. I don't have the numbers in front of me because it does change, but
like a couple hundred,
it's not. It's pretty low. If you have loss of use in both feet, that's SMCL. But keep in mind, which is higher than SMCK. But keep in mind that if you do qualify for loss of use, that should already start you at a 100% based on the diagnostic code, and then the SMC special monthly compensation is just a little bit extra money on top of that. So that doesn't mean if you're losing use in one foot, you only get $100 a month. It's just an extra bump on top. And if you have other special monthly compensations for other reasons, maybe you have need for aid in attendance, whatever it may be, then it starts to add up and bump you up even higher and higher.
It's super complicated.
It is.
It does. So this goes back to what Jenna and Elise were talking about before. It would benefit a veteran to write into VA to say, I can't walk almost at all. Someone needs to help me out every day to do X, Y, and Z. Saying I deserve SMCK, it's going to be, maybe you can add that in if you really want to somewhere, but what's really important is how it affects your ability to walk, your propulsion, whether you can take care of yourself, so on and so forth. So that sort of relates back to one of the points that you guys made earlier. So let's say your foot condition isn't as severe as what we were just talking about, but it prevents you from working, Jenna. Is there anything that veterans can do in that instance?
Yes. So entitlement to TDIU, which is total disability due to individual unemployability. I think it's a topic that we've hit on a lot.
Yes.
And so I'm sure we'll provide some links, and you can look at our website. We have a lot of information about TDIU. But just to hit the basics is if you don't have a 100% rating for your disabilities, your combined disabilities, but you are unable to work due to them, VA will pay you at a 100% rating anyway. So they're essentially recognizing that because your service-connected disabilities prevent you from working, and the rating code, the rating schedule is based on your impairment and earning capacity, if you can't work, then you should be getting a 100% rating. And so if you aren't working, or this is probably getting a little bit too into the weeds, but sometimes if you are working but aren't making enough, or are working in a very specific environment where you're being protected, you can ask VA to award you entitlement to TDIU. You really, I think we just keep hitting on this, you really want to explain, 100%. Why your service conditions prevent you from working. It doesn't just have to be your foot in this situation. Obviously, we're focusing on the foot disabilities, but if you have service-connected feet plus service-connected anything else, and they all combine to prevent you from working, you can talk about that. And if you are submitting a claim for an increased rating for your foot or for any other disability, and you as part of that claim, you assert that you can't work, VA has to kind of take that into consideration and start developing the record and start figuring out whether or not they can award you entitlement to TDIU. And so I think sometimes, veterans aren't fully aware of everything the VA offers, and so VA understands that most of the time, or at least is supposed to, and kind of have words that trigger VA's duty to do things. And so as long as you're being fully descriptive of kind of the way that your disabilities impact you, VA should hopefully pick up on that. But this is why we have these things, so that you guys know about this sort of thing.
Absolutely.
And basically, VA calls it substantially gainful employment. So if your disability doesn't allow you to perform substantially gainful employment, then you could get a 100% rating.
So we've also been talking about this sort of throughout the whole presentation, but maybe just to put extra emphasis on it, Elise, you want to maybe share one common mistake that you might see in your practice that VA makes when rating foot disabilities?
Yeah, I mean, the most common, honestly, is the clumping of, frankly, flat foot and plantar fasciitis. You see it often. They only rate you under 5276, and they don't give you that, or even consider that extra rating under 5284.
Pes planus.
Correct.
As opposed to the sort of catch-all.
So it's basically a failure to fully compensate all of your symptoms. You see that kind of across the board in all different realms, but it definitely takes place in the feet because the rating criteria is strange. So sometimes they'll see, they have pes planus under 5276. Let's just rate them there, and then they'll stop, and they don't have a full scope of all of your symptoms that are service connected being rated. Another one that I've seen actually pretty often is somebody may have a lot of different service-connected disabilities that they were diagnosed with, but then when VA goes to get a nexus exam, they only get an opinion on a select few of those diagnoses, or maybe just one. But when you, as a veteran, claim a foot condition, very broadly, say foot condition, and you have multiple diagnoses, it's on VA to really be getting a full workup of all of the feet condition that you have. They shouldn't be picking and choosing which one they assumed you meant. So that's a duty to assist there on VA.
Anything you would like to add, Jenna?
No, I mean, I think Elise kind of hit both the separate ratings and the wrong diagnostic codes. The only thing I think, this goes along with it is if, you, for some reason, you have both foot disability, you have a bilateral foot disability, and VA sometimes will only give you service connection for one foot, for example. That's something that I think happens a lot. Maybe it's unclear in service whether or not you hurt both feet or one foot, or a doctor just says that you have pes planus but doesn't go into detail about whether or not it's on one foot or both feet. That's kind of where I see some issues, and I think that happens a lot because veterans are then confused because they think it should be like the same with any kind of bilateral issue, like knees. Like they claimed both knees and then they only get service connection for one.
Sure. Yeah.
So I see that a lot.
All right. And so before we wrap up, are there any sort of last thoughts that you have that think that veterans should remember when sort of working on their claims, working on their appeals? We'll start with you, Jenna.
I think it just goes back to, be as specific as possible about the impairment that you suffer from, all the diagnoses that you have. Make sure that if you are going to a treating physician, whether or not it's VA or a private physician, try to get them to be as specific as possible and really go into kind of what they have observed as your treating physician, because that's going to go a long way.
I think mine would be go to your VA exams, even though they're not always the best exams and you might feel frustrated with the system. If you don't go, you really can, they don't even have to, they can just stop if you don't go to your exam. They'll say the duty to assist is a two-way street. We see it all the time. So go to your exam, and then if it's not thorough enough, then you can handle after. But if you don't show up to your exam, there's nothing you can do about it if they decide to stop pursuing your claim.
Start all over.
Yeah. And my last thought would be just don't give up. These this takes a really long time. It can feel really defeating, but there's ways to appeal decisions that you don't like. There's ways to get more evidence in support of your claim. So just keep fighting, because it doesn't always happen the first time. I guess that would be my...
It usually doesn't, unfortunately.
That's true. Fair enough. Well, thank you very much, everyone, for joining us on this edition of Facebook Live about fee conditions. Thanks again.